For today's class, we are going to continue our discussion on diseases and disorders of the integumentary system. We are first going to look at methicillin-resistant Staphylococcus aureus, commonly called MRSA. This is a contagious bacteria that can cause infections in different parts of the body. Now, MRSA is commonly found in soil. So if you were to have a cut on your leg and you were outside playing soccer and you fell to the ground, then MRSA could enter through that cut on your leg. MRSA is also very common in the patient care facilities, such as hospitals. And this is one of the big things that patient care facilities are trying to prevent patients from getting. And the reason why is MRSA is very difficult to treat with commonly used antibiotics. And these commonly used antibiotics can be things like penicillin or amoxicillin. And by not being able to treat, by making it difficult to treat with commonly used antibiotics, patients with MRSA have to resort to stronger antibiotics. Now, interestingly note, 1/3 of people carry MRSA, or also called staph, in their nose without any problems. However, it becomes hard to treat when the MRSA enters the skin bloodstream or if it gets into the lungs or the urinary tract. Now, the appearance of MRSA can look like an abscess, a bore, or a sore, and you can see that the wound can appear to, or the abscess, bore, or sore can be weeping to where it can have drainage. And because MRSA is so difficult to treat with commonly used antibiotics, it is also known as the superbug. Now, the treatment for MRSA is going to be dependent on how bad it is, how severe it is. And two treatment options include oral clindamycin and also IV vancomycin. The next disorder that we are looking at is called scabies. Scabies is caused by little mites that get under the skin. It is something that is highly contagious, meaning it's easily spread from person to person. And it causes a red, very itchy rash. And you can see the picture of scabies here on this slide. The treatment for scabies includes topical medications. Next we have Impetigo. Impetigo is a bacterial infection of the skin. It is something that is more common in young children. Impetigo is characterized by vesicles, which are these small fluid-filled sacs that rupture and then develop this honey-colored or yellow crust. Impetigo usually appears in areas that are exposed, like the face, nose, and mouth. And the treatment for Impetigo, because it is a bacterial infection, is antibiotic ointment. Next we have psoriasis. And psoriasis is classified as an autoimmune disease, so meaning this is a disease where the body is attacking itself. Psoriasis is also, because it is an autoimmune disease, it's considered to be chronic, so it's something that an individual has long term, something that has to be managed. Psoriasis is characterized by these silvery white patches on the skin, and these patches can burn and sting. There are various treatments options for psoriasis. It can include everything from topical ointments and moisturizers to things like light therapy and also medications. Next we have burns. So there are 3 classifications of burns that we're going to look at. You have what's called first-degree burns, which results in red, painful skin. You have second-degree burns, which along with having the redness also includes swelling and blisters. And then you have the third degree, which is the most serious of the 3, that results in white or blackened charred skin that may be numb. And in the picture at the bottom of the slide, you can see a first degree, second degree, and third degree. And what you want to pick up here is that the greater the degree of burn, the more layers of the skin become impacted. So you can see in the first degree burn that it's primarily that epidermis, that outer layer that is impacted. With the second degree burn, you can see that there are blisters located on the epidermis, but that the burn is now going through the epidermis and into the dermis. And then you have the third degree burn that impacts all 3 layers, the epidermis, dermis, and subcutaneous. So here we have a picture of a first degree burn, and something that is a common first degree burn would be something like sunburn. Okay. The treatment for sunburn can be, or first degree burn, can be to expose the area to cool water for 5 minutes. You can use things like the aloe vera gel that you get at the drugstore, and to also cover the area loosely, because you can tell when clothing touches a sunburn that it can be quite painful. Next we have the second degree burns. With second degree burns, and you can see in this picture here that it has, unlike first degree, you have the presence of blisters. And the treatment options for a second degree burn would include things like using cool water for a longer period of time, like 10 to 15 minutes, to cover the burn area with a sterile, non-adhesive bandage or a clean cloth. It's important not to apply any butter, oil, lotions, or creams, and it's also important to help prevent infection to not break the blisters. And then lastly, you have the most serious, which is a third degree burn. A third degree burn is dangerous in many ways, but understand that with the third degree burn that it's going to impact all 3 layers of the skin. If third degree burn is suspected, you need to call 911 right away. Cover the area with a sterile non-stick bandage, and if the area is large, then a clean sheet may be used. Now, burns can be assessed by what's called the rule of 9s. And what the rule of 9s does is it gives a quick estimate of how much of the body has been burned. The way the rule of 9 works is that the body is divided into 11 areas. And each of these areas is worth 9%. Okay? The exception would be the groin area, which is worth 1%. So looking at the illustration here of the rule of 9s, you can see you have the front and back of the head at 4.5%, along with the neck. So if you put those together, the back and front of the head is going to equal 9% of the body surface area. Then you can see that the front and back of each arm and hand is going to equal 9% of the body surface area. The upper back is worth 9%. The lower back is worth 9%. Moving to the front of the body, the chest is worth 9%. The abdomen is worth 9%. The front and back of each leg is going to be worth 18%. And then you have that last percent, which is at the groin, and that gives 100% of the body surface area. We are now going to look at some different types of skin cancer that are associated with the body. And skin cancer is the result of, or can be the result of, exposure to the sun or the sun's ultraviolet rays. And this is the most common type of cancer in people. So different skin cancers include basal cell carcinoma. Now this is going to be the most common and the least malignant, so meaning the least serious of the skin cancers. This usually occurs on the face, and treatment includes surgical removal of the area, and then radiation can also be used to complement that surgery to make sure that all of the cancer has been taken care of. Next we have squamous cell carcinoma, and with this one, this type of skin cancer grows rapidly and it metastasizes, meaning it spreads quickly to the lymph nodes, and that can make this especially dangerous because the lymph nodes are located all throughout the body, and so it means this cancer can more easily spread. Treatment for squamous cell carcinoma includes surgical removal of the area, and then also as another type of therapy to get rid of the cancer, radiation can be used as well. And then the last type of skin cancer that we are looking at is a melanoma. And a melanoma occurs in the melanocytes. So we know that the melanocytes are important cells that produce melanin. And a melanoma will spread or metastasize quickly. A way that you can detect a melanoma would be that it can occur as a mole that changes quickly. So you can see here in this picture you have this raised looking mole. It has kind of differing colors throughout. Its borders are also going to be uneven, and those can be signs that something is going on with this mole. Okay, it can indicate a melanoma. And then the treatment for melanoma includes surgical removal, radiation, and also chemotherapy. And that does conclude today's discussion on disorders and diseases of the integumentary system.